What's up, everybody? It is you. Sorry, I almost did some crazy stuff without recording it. What up, everybody? It is your boy Matt Turner back again with another video. Today I will be doing my 1 month post-op because I'm officially 1 month as of today, which is Tuesday, March 16th. So yes, I will just be going over the changes. I don't think anybody had any questions, but I will try and foresee any questions that you guys have and answer those in the video. But yes, let's just get straight into it. You guys know me, I had to go make some notes real quick or else I was going to get off topic real fast. So I'm not gonna make this super long. I'm gonna, kind of keep it as short as possible, and then at the very end, I will show you guys what my chest looks like, and I'll bloop up a picture of what I looked like just a few days after being post-op and I got my drains removed. So right off the back, I stopped having to dress my nipples at day 21. So that was around also the same time that I was able to start kind of light cardio. I asked them specifically, if I remember correctly, the days right, if I could start doing a little bit more cardio than they advised for most people. Also around that time, I believe day 21 that's day 14. So around on day 14, that was when I believe got clearance for sleeping on my side. Don't take all of this to heart for me, or like say that it's all like, how everybody would normally do it, because my days are really messed up. I'm gonna be completely honest. I'm kind of giving you guys approximations because I'm doing this all afterhand. But I started sleeping on my side. It wasn't very comfortable, I'm gonna be completely honest with you. And a lot of people say that they also don't find it comfortable sleeping on their side directly after surgery when you like get that clearance. So what I did is I would just kind of sleep on my side for a few minutes throughout the night. And then if I, got tired of it, I would just change, sleep back on my back. Towards the end of the week of when I finally got that clearance, I was able to start sleeping on my side. As of right now, I still have difficulty sleeping on my side. I only just recently started sleeping on my stomach, even though I got clearance way back then, just because when I sleep on my stomach, I don't like, no one does this. No one just sleeps on their stomach like this, I go like this or like that, and so I'm really cautious about kind of how I'm moving my arms around. So sleeping on my stomach isn't really as comfortable as I would like it to. In addition to that, I also found that one thing that helped with sleeping on my side was actually kind of like sleeping on my backside. So I would sleep like slightly angled, almost like, so let's say this would be sleeping on my side. I would sleep kind of like this. So like on my side, but also like on my back. And then, so that also really helped. Once I started kind of figuring that out, that really kind of made it easy to sleep on my side. Also using a pillow. Me and my girl's anniversary recently came up, so we went to the Georgia Aquarium. It was really cool. We got a stuffed animal. I'm only saying this because I did it recently, but if you can find something really soft, she had this beluga plush thing. Poor thing's probably been scarred to life, but I like using it to put under my armpit when I sleep, and it kind of really helps with not like putting a lot of pressure on my my drain incision area, and just kind of having like a soft cushion. So there is definitely that. If you can find a pillow, I would certainly do that. That has helped a ton. What else has happened? So I don't know, maybe it was just me. I don't know if I was different, but I think I had a little bit more intense scabbing than most people. I'm not quite sure, but my scab stayed on for a significant amount of time. My scabs actually didn't fall off, like all of them didn't fall off until literally just about, like literally this weekend. So like 2 days ago was when like the actual scabs covering my nipples started to fall off. I still have some that surround it, and I'm just kind of letting them do their thing, which has been really kind of useful and effective, is to just kind of like let them flake off however they please, whether it's from like my clothing or whatnot. I try not to pick at them. I'm not that great about that, to be completely honest, but I try to pick at them as little as possible and just let them flake off as they need to, and that's been effective. Also, I don't have to worry about whether it was the right time or not for them to fall off. They just kind of fall off as they please. So a lot of people are probably wondering what I do for scar care, and you'll actually see when I take my shirt off and I show you guys, I don't have anything on them. I don't use silicone strips. I don't use like Scar Away. I don't use that. I don't use gel. To be quite frankly, I'm not sure what I want to do for scar care. I'm not sure if scar care is really even necessary for my scars right now, because at least on the sides, they fade in very nicely, I feel like, with my scars, and all of the other scars I've ever had in my life generally will fade away, and I'm not too anxious about them or people seeing them in public. I routinely take off my shirt at the gym, in the locker room, all the time. I don't really care if people see my nipples or anything like that, because no one really knows why I have them, so it's just kind of like whatever. Like, you have pink nipples, and it's like whatever, you know. So I don't do any kind of scar care. The most that I do for scar care is I use this, which is just the CeraVe Daily Moisturizer. CeraVe Daily Moisturizer. It's for normal to dry skin, and I literally just take a little bit, about the same amount that I would normally apply on my face, and I just take 2 hands and I'll dab it, and I'll just rub it around the edges of my nipples and along my scars. And really my only intentions with doing that is to make sure that my skin is actually staying soft, not necessarily like, you know, scar treatment or anything like that. If it's doing that, great, but that's not what I'm doing it for. I'm trying to get better at just being hygienic in general and trying to keep up, you know, like skincare routines and everything like that, especially since I'm using minoxidil. But yes, no, I'm not doing any type of scar care. One thing I forgot to add on top of my nipples and scabs, once they did flake off, so I've kind of already mentioned it, my nipples are pink. I do have a little bit of pink pigmentation back, and I'm not sure, I'm not tracking them or anything like that, so I'm not sure if I'm getting more and more each week. I'm just kind of letting the process do what it needs to do, because there's other things in life I need to focus on, like getting a job, and, you know, getting my own place and stuff like that. So I don't really focus on like taking pictures of like my scars and things like that. Really, the only way that I'm keeping track of those things is me taking update photos on how my workout routine is going and my weight loss journey and my recomp journey. So that's really the only way that I'm noticing any kind of differences, and that's more than enough for me. Obviously other people feel differently, and obviously do what's comfortable for you, but for me, I don't find it necessary to track them. Let's get on to the part that you guys really want to see. I'm gonna fix the camera real quick. I already got one of my arms out. I'm gonna fix the camera real quick, and I will show you guys what my chest looks like 1 month post-op. This is it. This is my chest 1 month post-op. As you can see, like I said before, the nipples are pink. Actually, let me zoom this in a little bit and angle down so you guys can see. So the nipples are pink on the center, and then they have some pigmentation coming back around the edges. I still do have some scabbing, like this right here is still a scab. This right here is still a scab, but my nipples are very, very soft. Super soft, almost concerning soft, but I'm sure it's nothing, because I in general just have soft skin. Here is what my drain hole incision looks like. These for the most part have almost completely sealed up. This all right here is flat. It feels flat to the touch. This feels, this is the other side, this feels flat. And so I've been noticing, as you can see, like obviously it's very small. It's still hyper pigmented, I guess is the word I should use, and it stands out, but I'm gonna give it at least a few months to kind of start fading away. The only part that feels the most uncomfortable is this area right here where my incisions connect. If you know anything about DI and connected incisions, the middle is usually the most fragile because there's nothing really there holding it together like the rest of your body except for really kind of flesh. This is what my chest looks like. Oh, I can kind of do pec bounce again. So as you can see, I've been working on getting a lot of my chest muscles back. So I have been going to the gym. So that's great. So another thing that I did forget to mention when it comes to my nipples is that I still do 1 month out have a lot of nerve reconnection going on. So if you know anything like about nerve reconnection, it's kind of so like they take the graft, they take it off, and then they kind of suture it back up onto your skin, and then it is the blood supply is reconnecting, the nerves are reconnecting, and that's why they use that bolster to make sure that it's holding onto your skin, and so that those nerves can have a unhindered, I guess, process, which is why they're very, very strict about like, hey, don't like mess with the nipple bolsters, because when you cause friction, you are possibly disrupting that nerve reconnection process, and it's gonna have to start all over and everything else like that. But for those who don't know what nerve reconnection feels like, it feels kind of like somebody taking a needle and just kind of poking you, not like getting a tattoo where it's like a ton of needles and it's going very, very fast. For me at least, it feels like someone just took a needle and literally just pokes me once and then will wait a second and then poked me again with that same needle in the exact same spot. So it kind of like hurts, but it doesn't happen all the time. If anything, it's on a pain level from like 1 to 10. It's like literally like a 1 or 2, nothing higher than that. I wouldn't even really give it like a 2. It's like a 1.333 repeating. It really doesn't hurt that much. If anything, it's more of an annoyance. So I try not to focus too much on when it happens, but it kind of like makes my nerves jolt a little bit. So that's kind of where the annoyance comes from, because it just kind of happens and then my body reacts with it as well. Thankfully, I haven't been doing anything while that happens and I like spill water or something crazy. But yes, I'm still getting that back. For those that may not know, nerve reconnection it occurs almost all the way until the end of time. Like there are people who are still getting sensation back after 3 years of post-op, 4 years of post-op. So it's going to be a long-term process. Right now, the most that I have is pressure sensation, and that's really it. I had my girlfriend actually touch my nipple, and so this is the other thing. So I can feel when I touch my nipple because it's me and it's my hand. And so in my mind, I know I am touching my nipple, right? The same way like I know I'm touching my chest right here or my shoulder, right? But there's a difference. You'll have like two sensations when it happens. So like if you do it, you feel it on your shoulder, but also you feel it on your hand, right? So I have a struggle of understanding whether what I'm feeling is my hand just touching my nipple, or if I'm actually feeling anything in my nipple. And I know I'm not feeling anything in my nipple because I've had my girl actually touch it just to see like what would happen. Not to make this dirty, but I would have her touch it just to see what happened, and I can't feel anything when she does it. The only time I feel anything is when I do it, which is how I know it's really just me receiving sensation on this end. But when I do press down, I do feel pressure. So there's that. In the beginning, so one thing a lot of people don't talk about also, I'm noticing with two things actually. Other things that people don't really talk about a lot with top surgery that I'm noticing is that in the beginning, there's actually a lot of hypersensitivity, and it's like erotic. So like in the beginning when I still had my drains in, and even a little bit after my drains were taken out, but within that first like 7 to 8 days of being post-op, like I touched my nipples and it had like an erotic sensation, which I found was very weird because I wasn't expecting to have any kind of sensation. Well, not seven. You obviously can't feel anything seven days before because you have nipple dressings on. But after you get those taken off and you can like touch your nipples, that's when you can like feel the sensation. It's really weird. It's really weird. And then the second thing that I've noticed, just because I had another friend, I've had actually quite a few friends. March and February were just kind of the months of top surgery, it seems like, because me and my friends were all kind of back to back getting top surgery, and I love it. Squad is reaching their goals, but they don't get their drains taken out. I think there's this perception that as soon as you're going to get your drains taken out within that 6 to 7 days, and I think a lot of people don't talk about it because it's kind of like, something went wrong, like it was a complication or something like that, and so they didn't take them out. But I'm learning now more and more that a lot of people actually don't get their drains taken out exactly in that 6 to 7 day period. Obviously there's different ways of going about that, like maybe they get one taken out, maybe they don't get both taken out. So that's something I just also saw was very interesting. Trying to think if there's anything else that I need to talk to you guys about. I think that's all I have to say right now. If I left anything out, please leave it in the comment section down below. Like and subscribe. Thank you to everybody who commented on my last video on my joystick unboxing video and left a bunch of different YouTubers. Continue to do that. Feel free to continue to list those people down in this one. Again, help me blow up the YouTube algorithm by commenting in the comment section down below in the actual YouTube application. Let me know what you think of the progress. Let me know of your thoughts on skincare. Obviously you can't see my chest. I haven't done that in a while. I recently actually ran and it was the strangest feeling, but we'll go into that in another video. So yes, like, comment, subscribe, hit the bell notification so you can stay up to date on when I post videos. And it is your boy, Matt Turner. I will see you guys another day. I hope you guys have a great morning, evening, or night wherever you are. Stay safe, and I will see you guys later.